Hello, my name is Andrew Mccuen, and I am a current third year student at Kansas City University. Today, we are going to be working with Relapse Fear Responses. I just want to quickly thank you for participating and being with us today. So, here is a quick overview of what we are going to cover today. First, we are going to name a relapse fear invoking situation. Then, we are going to think about how our body responded and what our thoughts and actions were during these situations. And lastly, but most importantly, we're going to cover some methods and techniques that you can use during these situations. So the first thing to do is name a relapse fear invoking situation. This can be something that has happened in the past that led to a relapse, or something that you know might happen in the future to trigger a relapse. These situations can be different for every individual. It can be something as subtle as being in a room that brings back memories, and for others, it may be the loss of someone they love. There are many different situations that can trigger a relapse, and while you think of your own, I will just leave some more examples here. Another could be an injury that causes significant pain, or some unexpected stress in your life, such as a divorce, losing your job, or even being hospitalized with a sickness. Even relapse itself can be an invoking situation. So now, think about your own life and what situations could or already have led to a relapse. Now that we have named a situation that can lead to relapse, let's take some time to think about how your body responded. Were you anxious, depressed, were you maybe sweating or jittery, or maybe your body just shuts down? It is important to identify how your body reacts so you can better control your response during these situations. Your body's reactions to these moments may be an early sign to help you realize what might be coming next. The next thing to do is think about what thoughts you had in these moments. A lot of times in these situations, we start to have negative thoughts, which can lead to a downward spiral into relapse. If you can control these thoughts before they start to overrun your mind, you can help yourself better manage the overall outcome. Managing these thoughts can help you change your perspective on the situation and change it into something more positive. And let's finish with talking about what you did in these situations. Did you give in? Did you phone a friend? Or maybe you just broke down? So try and remember what you specifically did and think about what you could maybe change to have a better outcome. Overall, it is important to recognize when you are in one of these moments, because now you are able to talk through it and understand how you handled it. You can also now start to listen to your body more and catch early signs, which will allow you to react differently before it gets out of control. Understanding these three reactions will help you identify areas that you can change and also realize areas that went well so you can build on them. Now we are going to transition into discussing therapies and techniques that you can work on to help you overcome these relapse fear responses. The first one we are going to look at is cognitive behavioral therapy, or CBT. CBT is a comprehensive therapy that requires way more time than what we have to cover today, so we will just cover some of the main points. The first thing is to work with your therapist to help you with the following. So identifying a situation, becoming aware of your thoughts about these situations, consciously identifying the negative and inaccurate thoughts, and changing the way you react and think about these thoughts. So here's a link that you can visit to learn more about it, or you can get in contact with Freeman Health because they also offer CBT sessions. So if you're interested, let us know because we also have handouts that we can give you for more information. So this image may be confusing to you now, but it is a good overall picture of what CBT is. So when I was a behavioral health tech at a Vera Behavioral Health Hospital in my hometown, I was trained to lead these CBT groups for our patients. These were twice weekly sessions for about 4 weeks. So I like to think of CBT as getting in control of your thoughts during an emotional moment so that you can choose your behavior and decide how you are going to feel before you make any quick decisions that can lead to bad outcomes. So to put it into context for you, I will talk about a possible relapse invoking situation. So say you are in a fight with a loved one, and this is a moment that has been known to cause you to relapse in the past. So in this situation, if we look at the chart here, relapse is the behavior that we want to fix. So this behavior was a moment in time that happened so quickly before you had the chance to gather your thoughts and your feelings about the situation. What CBT does is train you to stop and consciously think about the situation first, which then allows you to choose how you are going to feel and react in the moment instead of reacting first and then your thoughts and feelings come later. So in this scenario, if you can catch yourself early by identifying the situation and using those signs that we talked about earlier, you can first think about what you are going to do. Then secondly, choose the behavior you want so that in the end, you can have positive feelings about what you accomplish. This example is much simpler than in real life, but with months of practice and working with your therapist, you can completely change your behavior to have positive outcomes. Another therapy that can be used is called dialectical behavioral therapy, or DBT. Like CBT, this is a therapy that requires weekly sessions for a couple of months with a certified therapist. It is a therapy that works on balancing negative thoughts and emotions through acceptance and change. So, this therapy is a little more intense than CBT, but is often used in conjunction with it. So, what DBT does is focus on regulating your emotions, controlling your thoughts through mindfulness, working on one's interpersonal skills, and distress tolerance. Since DBT also requires way more time than we have here today, I'll leave you with this link to WebMD, which you can go to for more information. Also, Freeman Health offers DBT and has handouts with more information, so just reach out if you would like more information on it. Next, I will quickly mention a few more methods and techniques that you can turn to. So, mindfulness was quickly mentioned when talking about DBT, but it focuses on being present in the moment and is sometimes used as a form of meditation. Another method is starting a gratefulness diary. So each day you would write in this diary about something that you are grateful for. This helps with changing your attitude at the beginning of the day. It also allows you to always go back and look in the diary and remind yourself of things that you are grateful for in your life and why your life is good. Another is trying to stay motivated by realizing how far you have come and everything that you have accomplished so far. Another is the 12-step program. It may be something that you have tried in the past, but it is also a very solid program that you can turn to that is known to work. And the final one here is to remember to give support to others that may be in a similar situation, and surround yourself with positive people that you know you can rely on and trust. And always try to be a person that someone else can turn to for support as well. So I want to leave you with this comment as we end here today. Continue to try and work on replacing your negative thoughts with positive affirmation. A lot of the therapies we talked about today focused on this. So when you feel like things aren't going your way or you are stressed out and maybe want to give in, try and think positively about yourself. Sometimes that even requires you to give yourself compliments out loud, repeatedly say that you can do it. So just remember how far you have come and continue to look to the future and not dwell on the past. It takes a strong person to want to make a change in their life, and that is what you are doing today. So thank you for being here with me today, and I wish you the very best.